Government stepped-up vaccination drive plus heightened public compliance with established health protocols have not gone for naught. The combination of institutional grit, hard work, and collective sacrifices made a dent in stemming the viral and variant outbreak, as the latest data attests to in this report from PTV's Mark Catalco.
The Octo research disclosed today that the reproduction number in Metro Manila slightly dropped to 1.34 this week, down from 1.39 7 days ago. This, despite the fact that the NCR continues to record an average of more than 5,800 average of new cases daily, with a one-week growth rate of 11%. The DOH said the NCR remains the top region in the country with the highest number of new cases, accounting for 28% of the total cases, followed by Region 4A with 22% and Region 3 at 11%. Metro Manila will be placed under Alert Level 4 starting tomorrow, but the Octa research has this recommendation to make it effective against COVID-19.
We're advocating now, whatever granular lockdown will need to be undertaken will have to be coupled, at least in the NCR, with testing, tracing, and isolation. And that these T3, testing, tracing, and isolation, will need to be expanded all over the country.
For some lawmakers, the government should focus more on the testing strategy to fight the pandemic. Former Health Secretary Janet Garin called on the government to pay for testing costs.
Hanggang hindi natin na-raise yung testing and tracing, kahit anong alert pa yung gawin natin, we will parang go back to the same problem.
No country in the world is using lockdown, whether it's general lockdown or granular lockdown, as a cure to the pandemic. The reason that we have lockdowns is for countries and our people to prepare.
They also suggest that booster shots should be given to healthcare workers and people with comorbidities due to some cases of breakthrough infection. Despite this, the DOH reported that the case fatality rate among healthcare workers and even those in the NCR went down in 2021. This may be attributed to the country's high vaccination coverage.
Note that the vaccine coverage for healthcare workers is 96% nationally and 94.7% in the National Capital Region. While we can see that there are more healthcare worker infections and cases in the past weeks, their case fatality rate remains to be low, most likely due to the high vaccination coverage and the protection of vaccines against severe disease and deaths.
Mark Fetalco for The Nation.